As a new day breaks over Mumbai, the megapolis, which is home to over 18 million people, a diverse team of medical practitioners head to a destination overlooking the shores of the Arabian Sea, to a 1 million square feet new generation hospital, a high-tech medical facility with advanced infrastructure, where an army of 300 full-time doctors, 800 nurses, and over 1,000 support staff work relentlessly to battle some of the most complicated and high-risk medical cases. A behind-the-scenes look into the working of this giant repair and maintenance unit for one of the most complex creations of nature, the human body.
To really see that where science has reached today, where technology has reached, is unbelievable. You have to see it to believe it.
Where there is no scope for error, because at the other end is a human life. This is an exclusive insight into the highly restricted zones of this world-class hospital. 1 hour of intense real-life drama as some of the best medical minds fight against all odds to save lives. This is inside Kokilaben Ambani Hospital.
Accident emergency department. What is the patient's name? Dr. Manthan, one patient is expected on venti.
Just got a call from a hospital. The patient is being shifted as a cardiac patient.
The accident and emergency department in a hospital is a live wire of tension. This is the first port of entry for every single case at night. And often the doctors have to make life-saving decisions within minutes.
She went into sudden arrest. Do you have EDRA? Yeah, paralyzed her totally.
In the A&E, every second counts. At the Kokilaben Hospital, machines are brought into the picture as quickly as the doctors. Portable X-ray machines and scanners are immediately wheeled to the bed without moving the patient. Blood samples are sent to the laboratory through a high-tech subway system called the pneumatic chute, which is webbed across the building to save crucial time and human effort in transporting these samples. The A&E is also where some of the most difficult cases come unannounced.
Apart from the patient management, it's also to take care of the relative. Relatives also need to be given the time-to-time information about what is happening, and the challenging part in the emergency is you cannot predict what is going to happen. One moment it is quiet and suddenly you have around 4 to 5 patients coming in immediately who might require urgent support.
Life at the Kokilaben Hospital is a constant cycle of curing people and saving lives. Some patients even come from halfway across the globe, seeking medical care. The journey has been long for Oshinovo, a 9-hour flight from Nigeria that he's barely been able to survive. For him, the Kokilaben Hospital is the last pit stop to save his life. His doctors in Lagos have already given up on him. Would this hospital be able to change his destiny?
How long he is having this problem?
22 years ago, when he was to enter the university, he was asked to go for an X-ray test. It was there that discovered that his heart had a defect.
You are able to sleep?
I've not been able to sleep. Months.
According to doctors, the treatment for Oshinovo was not going to be straightforward. He has a heart with weak muscles, which is deteriorating by the minute, due to which he stands 10 times the risk of dying of a sudden cardiac arrest than a normal person. For the hospital, this is a crucial period. The cardiac team would have to come together to chart out a roadmap immediately to save his life.
Tomorrow is the most important day when we are going to decide the further plan and treatment about him.
We get a lot of international patients coming in from different parts of the world. They come here not because those treatments are not available in those countries, but because very often the doctors in those countries have given up hope. In such cases, where if the outcome is good, it's a winner takes it all kind of situation. However, if the outcome is not good, it can actually damage your reputation in those countries.
Hello.
Now his heart is dilated. This is a normal heart and this is his heart. In his case, the heart is not contracting synchronously.
A plan is quickly drawn up. A highly specialized pacemaker-like device called the cardiac resynchronization therapy defibrillator would need to be implanted to regularize Oshinovo's heartbeat.
And this will be done by my colleague Dr. Venkat, who is an electrophysiologist. He specializes in the device treatment.
The doctors would have to race against time to operate on this patient who has traveled thousands of miles from a different continent, with the hope that this surgery will miraculously save his life.
Tomorrow is the big day because it's nice if you can lead a normal life, which is what they are assuring us, because at 42 it's rather young to have half a life.
Running a hospital of this scale, which has 750 patient beds, is a complicated process. Bed allocation and patient management requires close monitoring and contingency plans on standby.
So we have a lot of pressure on the beds, and sometimes we're going to have to convert the accident emergency into sort of a mini ICU so that we do not turn away patients who are very, very ill. There is no time wasted. Excuse me, I'll just see this patient who's just rolled in. We just have a look at him.
While the doctors and nurses are at the front end, a synchronized team of professionals work around the clock to ensure that the logistical support required to perform surgeries is flawless. The build-up to any surgery begins a night before, with the preparation of the operation theaters. Since every surgery requires stringent sterile control, every night a team of healthcare assistants fumigate the OTs to prevent them from being contaminated. All surgical instruments used for the surgeries, which come in contact with blood and infection, are disinfected at the Central Sterile Supplies Department, one of the largest in Mumbai. This is an extremely important process. It is here that over 4,000 instruments are sterilized to be used for up to 70 surgeries that may come up in a single day. They are then sent to the OTs through a dedicated and sophisticated transport system of dumbwaiters so that they remain infection-free. In one of the operation theaters, the nurses are doing an inventory check for an important brain tumor surgery planned for the day. Neurosurgeon Dr. Anand and his team will be operating on his patient using an advanced imaging technique.
Santosh is a 36-year-old gentleman who had a low-grade tumor of his brain. It was operated 2 years ago, but now it has come back, it has grown larger, and this needs to be taken out as much as possible without creating trouble to his nerves controlling his right hand and leg movements. This region here is the tumor. And these are the areas responsible for his movement of his right hand and leg fibers. And this is what we have to preserve. So our aim is to get this tumor out as much as possible.
Santosh has been operated at a different hospital twice before he came to Kokilaben Hospital. To tackle his aggressive tumor, Dr. Anand will be using neuronavigation and an advanced imaging technique called the intraoperative MRI.
Navigation, please.
Unlike Santosh, many patients who come to Kokilaben Hospital at an early stage in their cancer need not go in for surgery at all because of highly revolutionary radiation technologies like the Trilogy and Novalis TX.
The USP of these machines are they can rotate around the patient and the radiation beams can be delivered by any angle. They rotate 360 degrees around the patient. They deliver very high focus dose of radiation to your target area.
In the meantime, Dr. Anand has made more progress on the brain tumor surgery for Santosh.
The challenge in these kind of brain tumors is that it's very close to areas which controls the right hand and leg movements. Now, while we operate, we know anatomically this is the area, but we don't know whether we are trespassing that area or not. So if we find in the intraop MRI that there is something left behind, we are going to go in and give them the benefit of a second procedure. This maximizes our resection with a lot of safety also.
Let's see how much we have taken out, and probably then I can take out some more in depth.
The 3-room intraoperative MRI is one of the wonders of modern technology. Before the use of intraoperative MRI systems like the Imbris, surgeons had to wait until the next day and perform a subsequent MRI to see if the tumor was gone. But the brilliance of this system is such that it can scan the brain during the surgery, give an image result in a few minutes, helping the surgeon to plot his next move. The intraoperative MRI was used 3 times in this surgery, saving the patient 2 more trips to the operation theatre.
I think we should have got more than 90% out this time. It's paining a bit? Yeah. Just lift up gently as much as you can. Yeah, very good. Tell me your name loud and clear.
Santosh.
Very good.
In another corner of the hospital is 9-year-old Harshal Patil. He suffers from thalassemia major, a blood condition where defective red blood cells are produced in the body. Harshal needs a blood transfusion every 20 days of his life to keep him alive. And the only way out is a stem cell transplant, a treatment offered at very few hospitals in the country, since it requires sophisticated infrastructure and a super specialized team of doctors.
First step in a bone marrow transplant is to first what we call destroy the immune system of the patient to begin with. You must literally wipe the slate clean. And when you wipe the slate clean, that person's immunity level is absolute 0.
In a bone marrow transplant, the patient's faulty stem cells are destroyed by a very high dose of chemotherapy. Once the marrow is empty, it is replaced with healthy stem cells derived from a compatible donor, almost like rebooting a computer. In Harshal's case, stem cells will be taken from his 4-year-old sister. Here, all bone marrow transplant patients undergo chemotherapy in a highly sterilized environment, an isolation room that has restricted entry for outsiders. Even the food served to the patient is passed through UV rays to filter out any scope for infection. Our team was allowed in only after the equipment and crew was thoroughly sterilized before shooting. This transplant room has air curtains to filter dust and special HEPA filters to keep out bacteria, virus and fungi, for it plays a crucial role in protecting the patient whose immunity level is so low that even a bug bite could be devastating. Meanwhile, the stage is set for Dr. Nagarajan and his team to implant the biventricular defibrillator into Oshinovo to help regulate his heart.
Hello, Mr. Tapito. Hi there. Have you been able to take little walks around the corridor?
But a day before the surgery, there is a problem.
As I told you before, I was going to do this procedure called biventricular defibrillator, but we have got your blood results today, and that shows that your liver function tests are not right. You are an acute liver failure. So we will need to defer this procedure, and we will need to take the opinion of our liver specialist. I'm sorry that this comes as a bit of a shock, but I think sometimes it's best not to do the procedures, and we will have to wait for things to get better. In some ways, if you're not stable, I'm not going to do it. I would send you back to Nigeria without doing the procedure.
Hospitals are an inextricable part of our lives. Most of us are born in one, and a large number of us may die in one. But the truth is, nobody likes to stay in a hospital.
There is this fear of the unknown in the patient when they're coming in. Someone has gone into depression, someone is in a state of rage and anger. Why me? Why should I get this disease? Here you have to get them out of that, get them prepared to undergo surgery or a complex procedure. They can get angry, yet you have to smile, you have to deal. It's a very, very tough job.
In the pre-operation area, the nurses have an important role to play besides their jobs of getting anxious patients to calm down.
Normally we won't get like the child, and that's why we got surprised by like she is very calm and quiet. Otherwise it's difficult.
Harshal's 4-year-old sister waits while Dr. Rathod gears up for the bone marrow transplant.
Dr. Sen is just injecting local anesthesia now.
Dr. Rathod will be working with a pediatric oncologist to alternately withdraw only 2 to 3 milliliters of bone marrow each time.
Yeah, we are drawing this bone marrow alternatively from either side to basically avoid dilution. So we have just finished the stem cell harvest, and we have collected 250 ml of bone marrow from this kit, and this is the bag.
This bag of bone marrow can change Harshal's life forever. On the other hand, the roller coaster ride for Oshinovo continues.
And hope everything goes well for him.
The liver specialist confirms that the problem with his liver stems from the heart. It's a catch-22 situation for the hospital. To save Oshinovo's life, they must operate on him. But in such a critical condition, there is also a high probability that Oshinovo may die on the operation table.
He's a miracle worker and he'll complete it. We are going back to Nigeria with testimonies.
Meanwhile, the bone marrow collected from Harshal's sister reaches the laboratory. The samples come with a unique patient barcode, which prevents mix-ups, after which they are processed through high-tech machines. The bone marrow needs to be tested one final time for a compatibility match before they permanently become a part of Harshal's system. The big moment arrives. The harvested bone marrow is slowly administered to Harshal intravenously. And through the bloodstream, these stem cells will make their way to his bone marrow, where they will create their new factory of blood cells. Over the next few days, it will be a wait-and-watch situation for the doctors to see whether the body accepts the new bone marrow or not.
Compassion is the cornerstone of our care, and nobody goes back without medical help at Kokilaben Dhirubhai Ambani Hospital.
The hospital is a great leveler. Here the young and the old have their own struggles and their own battles.
Thank you.
For Kavya, a 14-year-old who met with a traumatic road accident, the Kokilaben hospital has been her second home for months.
Kavya is a good girl. किसने कहा? मैं खुद अभी के लिए. अच्छा ठीक है.
Losing both her parents to the accident, Kavya herself suffered severe brain injury, leading to significant loss in her memory, accompanied by lack of vision and speech.
काव्या का क्या उन्होंने बोला था आईबॉल बाहर आ गया था बट उसका ऑप्टिक नर्व डिस्कनेक्ट नहीं हुआ था 17 फ्रैक्चर हैं इसके फेस पर
चीटिंग करेगी चीटिंग काव्या
Completely bedbound with lack of balance and coordination in her body, she had also lost control of basic human functions and was dependent on tube feeding and a urinary catheter. But at the neuro rehabilitation department, where she was transferred to 6 weeks after the accident, rehab specialist Dr. Abhishek and his team were determined to restore Kavya back to leading a normal life.
6, 7.
With the intensive training sessions, the team planned a complete relearning process for Kavya right from the basics of teaching her how to walk. And in only 5 months, her recovery has been a marvel.
Very good.
She can now perform most of the daily functions independently, and hopefully she will soon regain the abilities of a child of her age. On the 3rd floor, Dr. Nagarajan and his team finally decide to go ahead with the operation to save Oshinova's life. The mood is tense in the cath lab. The entire team feels the gravity of the situation. And there is an additional pressure. Throughout the surgery, Oshinova will be awake. It would be too risky to put him under general anesthesia since he may not regain consciousness.
About 12.5 and then it moves. Okay.
The procedure of implanting the biventricular defibrillator entails introducing the 3 leads connected to the main device called the pulse generator into the chambers of the heart.
2.3, you can sense something. 1 or 2 senses, that's it, it goes away.
Oshinova's heart is so diseased that each probe encounters dead tissues and 0 signals. If Dr. Nagarajan doesn't get the signals soon, he may have to abandon the operation. The complications escalate at each step for Dr. Nagarajan as he tries to find the local electrical signals from Oshinova's heart. The minutes tick by before Dr. Nagarajan finally gets some response and can insert the device. The only step which would have to be foregone is its testing. Under normal circumstances, a ventricular fibrillation is induced on the table, causing a cardiac arrest to test the device for its successful functioning. But in Oshinova's case, that would be highly dangerous.
Although it's been quite challenging and stressful, I'm very satisfied at the end of the day that we were able to complete the procedure the way we wanted to. And I feel the cases that you are stressed the most are the ones that give you the maximum satisfaction as a doctor.
Every patient lives on the hope that his destiny will change. For Harish Bhandari, the past 3 years have been a living nightmare. Diagnosed with end-stage kidney disease has led him to a life dependent on dialysis. A machine does the job of his kidneys, cleaning the blood of toxins 3 times a week, each session lasting 4 hours. Missing even one session could be critical, and only a kidney transplant can save his life. Though his wife is willing to donate her kidney to him, unfortunately she is not a suitable donor.
Approximately I'm spending today 35 to around 35,000 only for medicine and treatment, the up and down. 4 hours for process, आना जाना और process के लिए सब 6 to 7 hours per day gone.
A hospital is a sanctuary for our physical, mental and emotional well-being. While most people walk into a hospital seeking cure, it is important to make sure that they don't walk out carrying contagious infections.
Okay, thank you very much.
All the best.
Okay.
Hope to see you soon.
Soon, if not Next week, maybe earlier.
Yes, I hope so too.
Kokilaben Dhirubhai Ambani Hospital has been designed to shatter the stereotype fear that people have of hospital. There is no claustrophobia here. There is only space, no grimness, no darkness, only light, hope. And I think that's what people want when they walk into a hospital, because they're already coming in such a low state of mind.
Everything about the Kokilaben Hospital is designed to not look and feel like a hospital. Right from the signage, which help the patients navigate their way around, to the 178 air handling units, which constantly pump in fresh air, giving the environment a natural feel.
In this environment where you're going to have a complex mix of cases, it is critical to watch your infection control policies so that what we call hospital-acquired infections are minimized.
Even after the surgeries are over, an important part of the infection control program is to get the biomedical waste sorted. There is a special color coding followed to ensure that all the infected and biohazardous material is well segregated, labeled, and then appropriately disposed of. In the meanwhile, the challenge for nephrologist Dr. Shruti was to find someone who was a compatible donor for Harish Bhandari. After a rigorous search, she seemed to have found a solution. Sitansh Shah, another patient on dialysis, whose wife is a willing but unsuitable kidney donor to her husband. As luck would have it, both Sitansh and Harish's wives were compatible matches to donate kidneys to each other's husbands, which meant Harish's wife could donate to Sitansh and Sitansh's wife could donate to Harish. The only hurdle in the way was to obtain the necessary legal permissions to go ahead with the swap kidney transplant, one that would save 2 lives. Saving lives day after day, in another corner of the hospital is Dr. Suresh Rao, a pediatric cardiovascular surgeon. He heads the pediatric cardiac department that handles around 750 cases a year. Most of the patients he operates upon are a couple of months, a couple of weeks, or even a few hours old.
In our life, I think every hour is an exam, every surgery is an exam, and of course every day when we deal with these children, it is also an examination. But in our exams, there is no second chance. The family goes home without a child.
Dr. Rao's next patient is 2-year-old Arjun Shile, who has no idea that the next few hours of his life will be spent on an operating table with his chest cut open and his heart exposed. Arjun was born with a large hole in the heart and an obstruction in the blood flow to his lungs. To repair the hole in the heart, a synthetic non-reactive patch is hand-sewn around the hole to cover it. Not only does this need extreme precision, but also extremely steady hands for a surgery that will go on for about 7 to 8 hours.
Cardiac itself is a super specialization, but when you have to handle smaller children, I think the degree of skill has to be of very high order. An extra millimeter here and there can cause distortion, so it has to be perfect. Stitching 2 things is very simple, but to develop how much to cut, how much to enlarge, that comes only with years.
An open heart surgery means that the heart needs to be emptied of blood and opened to correct the defect. And for that, the heart has to be stopped. Once the heart is stopped, it's a race against time to mend it. A heart-lung machine takes over the oxygenation of the blood and pumps it to the rest of the body. For the hospital, these high-precision machines are the lifelines for surgeries, and it is crucial to keep them running smoothly at all times. A team of biomedical experts is constantly on the go to check and repair the 2,600 pieces of high-end equipment that the hospital has and the doctors depend upon. Within the walls of these 21 operation theatres, more than 20,000 complex surgeries happen every year. One of the 70 surgeries scheduled for the day involves using the revolutionary technology of robotic arm, which combines the skills of a surgeon with the precision of a robot. Dr. Yuvaraja will be operating on 61-year-old Navnath Vaidya, diagnosed with prostate cancer. Of the 3 options given to Navnath, he has consented for the removal of his prostate gland using robotic surgery instead of the traditional open surgery or laparoscopy.
बड़ी एडवांस तकनीक है तो ये कुछ सक्सेसफुली होगा ना, ब्लड लॉस भी नहीं है, थोड़ा सेक्स के ऊपर भी इसका असर होता है लेकिन इसमें नहीं होगा.
Unlike any other surgery, here the surgeon's chief assistant is a robot. A giant computer with 4 arms that have endowrists, which are far more flexible than the human hand.
Human hand can rotate only 180 degree, whereas this instrument rotates 3 times.
3 arms hold surgical instruments, while the 4th is a camera arm, which not only gives a 3D image, but also magnifies the image up to 10 times. These endowrists enter the body through tiny incisions. Once inside, they follow the commands of the surgeon to perform movements like cutting, lifting, cauterizing, and stitching. This machine requires the surgeon to sit a few feet away from the patient at a console, from where he can control every millimeter of the robot's movement. Once the robotic surgery is over, usually within 24 hours, the patient can be up and on his feet again, ready to go home in about 5 days. Perhaps the biggest challenge for a young hospital like the Kokilaben Ambani is to constantly assess, evolve and upgrade itself to provide world-class facilities to the patients.
So whenever it comes to technologies which we feel are adding to standard of care, we have always gone ahead and bought them, even if sometimes it may not make commercial sense. Because we believe that finally patients have to get the highest standard of care.
Back in the operation theatre, Dr. Rao and his team continue to operate on 2-year-old Arjun Shile.
We work shoulder to shoulder with only one aim, that is, this child should do well. Every cog in the wheel has to be strong. Otherwise, we won't have outcomes. What I do in the operating room is maybe about 50%. The other 50% is handled by all the other guys in our team. It's a very closely knit team which finally yields the outcomes. And now he's off, he's on his own now. His vest's been disconnected from the heartline machine. We are good tailors, we are good engineers, we are good electricians, plumbers, everything into one.
8 long hours later, with his heart repaired and beating on its own, Arjun is wheeled into the pediatric cardiac ICU. Here, his life will be entangled in tubes for a few more days before he can step out into the world. Being in the medical profession has its flip side.
You are a tough guy here. You are no emergency. You solve them here. You don't create them. Okay? See, it's impossible to totally switch off from what's happening in the hospital, and it is not possible to disentangle one's emotions entirely from the patient also. Ram Sevak ji, how are you? Good morning. But yes, it is a highly stressful environment, and one has to just learn to deal with it because it comes with the territory.
Typically, you would have a doctor visiting 2 to 3 hospitals during the day and also having his own private clinic in the evenings. Unlike that, here the consultant is exclusively working in this hospital.
Whenever we get some free time, this is the place where we sit and generally have a cup of coffee, and as you can see, we just have some time for some fun and jokes. Right now, actually, I'm on my way to see a patient.
A new lease of life will be given to a 54-year-old patient who has oral cancer through a jaw reconstruction surgery. On the face of it, nothing seems to be wrong with him. But inside his mouth, he has a tumor attached to the jawbone. He will need the tumor to be removed along with the jaw, and a bone from his leg will be used to replace the jawbone, almost like a transplant within his body. The anesthesia plays an important part, especially in this surgery.
We usually pass the tube through the oral cavity. Now in this case, because the surgery is involving that, we share this airway with the surgeon. So we pass the tube through the nasal passage.
You want me to give a oblique this thing, or you want me to give a step like this?
Step like this, whatever is feasible. As much as bone you can play, even the oblique is good.
Okay.
Two teams of doctors will operate on the patients simultaneously. The cancer surgeon, Dr. Deshpande, will cut open the face and remove the tumor, while the plastic surgeon, Dr. Kazi, will take out the bone from the leg with its attached nerves and blood vessels.
You are forced not to have a bad day when you are doing a microvascular surgery. No irritation, no anxiety, very, very steady hands. You cannot have tremors. Even a fine tremor will be 10 times, 15 times magnified.
Dr. Deshpande continues to work meticulously on the face.
I need to go beyond the tumor and take out the jawbone.
In the meantime, Dr. Kazi grafts and takes out the leg bone. Titanium plates are first used to get the template of the jawbone, after which the leg bone is shaped and then fitted where the jaw was. The last step, of course, is to put the flaps of the face back together and stitch them up.
Break for lunch. You do operation every day, so it doesn't affect your how you feel or whether your appetite is compromised because you have seen so much of blood and flesh. No, it doesn't. In the beginning of the career, maybe it happens, but after so many years, it doesn't affect our appetite, and we can still have a very good lunch after a long surgery also.
9057.
At the back end, the kitchen is a whirlwind of activity. More than 3,500 meals are prepared here every day for the patients.
Nobody likes to stay in a hospital, so you have to try and keep the meal very interesting. Mash diet or salt-free diet भी देना taste करने को.
Dietitians, kitchen supervisors, cooks and support staff work like an army to make sure that the meals get to the patients on time and according to their specific requirements.
Right now what basically we are doing is trying to check if all the extra orders are ready or not. Diabetic chapati आया नहीं है ना, please wait करो, hold करो.
What is of most importance in the kitchen is infection control. Every 20 minutes, it is mandatory for the staff to wash their hands, whether they've handled the food or not.
Now we are going to do a very interesting thing is to load almost 250 to 300 trays of patient food within 1 hour.
The day has dawned for the two-way kidney swap, which is a highly synchronized procedure.
So I'm just trying to be sure that there are no medical hurdles which are there in the way. There are no technical hurdles.
The surgery involves a large team of transplant surgeons, nephrologists, as well as highly skilled nurses. The process is the same for the two sets of donors and recipients. First, the recipient is prepared, then the kidney is harvested from the donor. The harvested kidney is perfused to clean it of toxins and keep it functional. Then the kidney is carried to the room where the recipient is. In a painstaking procedure, this healthy kidney is put in and sutured. After several hours and without any complications, the swap transplant is finally complete. The doctors would now have to wait and see if the new kidneys are accepted or not. For the doctors, the quest to improve human life is a constant process. In another corner of the hospital, a team of doctors gear up for an equally complicated transplant, this time of the liver. The liver transplant department offers hope to thousands in the country for whom liver failure is a sinking reality. Hope is what binds lives in the hospital. It is what drives doctors to find breakthrough treatments. It is what keeps the patients believing in their treatment, even if the odds are stacked against them. For her doctors and support staff, Kavya has become a special part of their lives.
Sorry.
Thank you. Happy birthday.
And after 5 months at the rehab, she returns home to reclaim her life. Life pans out for the other patients as well. A few days later, Harish and Sitansh are well on their way to recovery, with a brand new addition to their body and an extra boost to their spirit of living. As Arjun walks out of the hospital with his heart healed, Dr. Rao walks into the operation theatre to save yet another fragile life. Oshinovo has had a miraculous recovery. What would otherwise have taken 3 months to show results has, in his case, taken much less time.
You could see me the night I came in. My life is a miracle. Lovely sister, God bless all of you. I'm so grateful.
And the cycle of life continues at the Kokilaben Ambani Hospital.